Knee pain can be something that sticks around for a long time. And in a recent study that I looked at, pain at the front of the knee, which is also known as patellofemoral pain, can last for up to 4 years. So in today's video, I'm going to share with you the best ways that you can stop that from happening. We're going to go through some mistakes that you can avoid. We're going to go through some strategies you can deploy to help stop yourself from going through this cycle of constant knee pain. My name is Ed. I have a specialist knee pain clinic in Southwest London. The first mistake that lots of people make is focusing on reducing the pain too much. So in the clinic, we would call this step 2. And this is where we're treating the short-term problem. So massage feels great, hands-on treatment feels great, painkillers can sometimes be helpful, anti-inflammatory gels, sometimes people use dry needling or acupuncture, sometimes taping can be really helpful. But for us in instant physio, step 2 is designed to help prepare the knee for the next 3 steps after that. So there's 5 steps to the 5-step method. And if all we do is focus on the massage, the pain relief work, which is sometimes what we call passive treatment, what happens is how much the knee can tolerate reduces. So if we're not doing strengthening, we're not stressing the knee, we're not exposing it to work that it can't tolerate, and then is therefore going to adapt to that load, then all that happens is how much the knee can tolerate either stays the same or goes down. So that pain that you get climbing the stairs, which feels better with the tape on, won't necessarily get better long-term because the work that needs to happen, for example, strengthening work, isn't being done. So that can be a mistake that I see lots of people make. Sometimes people come to the clinic, they've had treatment elsewhere, and they've basically just had those types of treatments. And say if they're a runner or someone who's what we call an everyday athlete, and they want to get back to doing something they're passionate about, like exercise, then those types of treatments aren't going to get you there basically, because they don't expose the knee, they don't build resilience, and they don't expose the knee to what it needs to be able to do, for example, in a hockey match or on a long hike. The second mistake that I see lots of people make is they get stuck in the strengthening phase where we're doing all the good stuff to help treat the root cause, and that's what we call step 3. In step 3, we're doing strengthening work, we maybe do some jumping, plyometric work, and maybe doing some coordination and control work, and some range of motion. We would assume the range of motion would be back to where we want it to be at that point. And we're really preparing the knee for what it needs to do on a football pitch, or just out on a hike, or even just walking out in the park, or even doing some gardening. We're just exposing the knee to the stress that it needs to tolerate in those chosen activities. We see lots of benefit, pain reduces, and the knee becomes more tolerant and more resilient, which is great. But sometimes what I see people do is, once the pain is reduced, they feel stronger, and maybe 12 weeks has passed. So they use a kind of time-based criteria. They just jump back into what they were doing before. So rather than using special tests that we would use in the clinic, they're just using their intuition. They're sort of seeing the fact that their pain is less, 12 weeks has passed, and they've been doing all this rehab and strengthening work, and it feels stronger. So those 3 things are enough for them to think, great, I'm back, I'm better. I'm going to go back to my 3 5Ks of running a week. And within a week or 2 or 3, the problem comes back. And that could be a real common thing that I see, where they haven't got enough evidence to demonstrate their knee is able to go back to training, exercise, being active again safely. And then pain comes back once they expose the knee to those kinds of amounts of stress. So step 4 in the 5-step method would be where we would do what we call the return to play testing. Now, this is where we would be testing for endurance, for strength, or plyometric capability, for power. And sometimes we would use the activity that someone wants to get back to as a test as well. So don't play 90 minutes of football, play 10 minutes of football down the park, and then incrementally increase how much that person is doing. Or for a runner, it might be 5 minutes really slowly, then 15 and 30 minutes. And these are ways in which we can get enough evidence to demonstrate that knee is tolerant and ready and safe to go back to what it needs to be able to get back to. People who don't do this run the risk of going into what they used to do and having a problem where the knee problem comes back. So what we need is lots of data, lots of evidence, and even how the patient feels, how confident they are. Have they returned to what we would call thoughtless, fearless movement, where they trust their leg again? I had a lady who'd dislocated her knee, had surgery to stabilize the knee. She was so worried about it happening again. She kind kind of flatlined really at sort of step 3, and she was really nice and strong. Everything was testing really, really well. But mentally, she just wasn't there. She felt like if she did some training or whatever, it would dislocate again. And funnily enough, only when she fell over and landed directly onto her knee and it didn't dislocate did she move on and start to kind of get that confidence back in the knee. Now, obviously, we're not going to be making our patients fall over and hurt their knee. But it's just an example of how the mental side of things and confidence is so important when it comes to returning to sport, returning to activity. And then the last mistake that I see lots of people make is they maybe go through a course of treatment, they get some pain relief, they get rehab that helps them really make a lot of progress. They maybe pass some tests and they've kind of got enough evidence to demonstrate that they can safely return to their activity, and then everything just stops. So the work they've been doing over the last 12 weeks, maybe 6 months, has been really beneficial and has worked, and they go back to what they were doing, and everything else in terms of rehab, prehab, strengthening, whatever you want to call it, stops. The risk of that happening is that the muscles that you've been targeting that were potentially not doing their job very well start to decondition, start to get weaker, start to not do their job as well. And maybe movement control, resilience, and tissue, the load tolerance in the tissues starts to reduce. And then even though everything's back to 100%, you're back to doing what you love doing. Because you're not doing the preventative work, the problem can often come back. And that's what we call step 5, prevent and protect. What we do in the clinic is give people a toolkit of things they need to continue with. And we also offer strength programs and strength training to help our patients who want to work with us either one-to-one or in small group classes as well. There's so much evidence to demonstrate this is a really good way of preventing injury. And I'm going to do another video on that. People who don't do that and they just completely stop everything are at a much, much higher risk of the knee problem they've been fighting coming back. And it would be great to think, okay, I just need to do these exercises for 3 months and I'm cured. But unfortunately, most of the time that's just not the case, because after today, I want you to have a think about where you think you're at and what mistakes you've made. Leave a question in the comments box and I'd be happy to help. Thanks for watching. I'll see you on the next one.